Hi, I'm Dr. Ernesto Tarango and I'm going to be attending you today. Can you give me your name?
Yes, it's Anmi.
Okay, Annie. Let's see what you have.
Yes, doctor. For the last 7 months, I have been feeling abdominal pain. I have been feeling diarrhea and then constipation. And there is mucus in my stool. Also, I have bloating and gases.
Okay, Annie. Because of your symptoms, I'm suspecting an irritable bowel syndrome. So I'd like to request a computer tomography colonography, also known as a virtual colonoscopy. This is a specialized CT scan that helps us examine your colon and rectum for things like polyps or other changes that could indicate disease. It's less invasive than a traditional colonoscopy and doesn't require sedation. To get accurate images, we need your colon to be completely clean. This means you'll follow a clear liquid diet the day before the scan. Things like water, broth, clear juices, tea or coffee without milk, and gelatin. You will also take a laxative to empty your bowels. We may also give you a small amount of oral contrast to help highlight any remaining material in the colon. On the day of this exam, please avoid eating or drinking for several hours beforehand, usually starting at midnight. During the test, a small tube is placed in the rectum to gently fill your colon with air or carbon dioxide. And this might feel a bit uncomfortable, but it's quick and safe. The scan itself takes just about 15 to 20 minutes and you will be able to go home right afterward. No sedation is needed. This test is very low risk. Some patients feel mild bloating afterward from the air, but it resolves quickly. Very rarely there can be discomfort or minimal irritation from the tube placement. Do you have any questions or concerns about the procedure for the preparation, Annie?
No, doctor.
Okay, so if everything is clear, then do you give your consent for us to proceed with scheduling the CT colonography?
Yes.
Okay, thank you very much. Hi again, Anmi. Here it is your CT scan of your colon, and well, don't worry, this is a normal CT scan. Because of your symptoms that you have, and you have this recurrent abdominal pain that you told me is on average at least one day per week in the last 3 months, and that is associated with pain with defecation or and a change in your stool frequency. And you mentioned changing from constipation to diarrhea. This indicates that you probably have irritable bowel syndrome. So, in irritable bowel syndrome is a disease that is like more physiologic and not structural. So, in that's why in the CT scan you can see a normal colon. In the this only varies in length and size, but it doesn't have some structural cause that indicates of inflammation or something like that. So don't worry. Do you have any doubts that you want to clarify about your study?
So everything is okay, doctor, in my study?
Yes, this is a normal CT scan showing just your colon. Yes.
Okay. No, I don't have any doubts. Doubts, doctor. Thank you.
Okay, perfect. Hi, I'm Dr. Ernesto Tarango and I'm going to be attending you today. Can you give me your name?
Yes, it's Anmi.
Okay, Annie. Let's see what you have.
Well, doctor, since last night I started to feel pain in this part, and then it moved to this one. The pain is exacerbated when I press this zone. Also, I have nausea, vomiting, fever, and I don't want to eat. That's basically all my symptoms.
Okay, I understand. So, because of your symptoms, we suspect an acute appendicitis. So, for this, we need to do a study called a CT scan, which is with radiation, we obtain images of your abdomen so we can see this your appendix. Also, we will be doing an abdominal ultrasound to check with sound waves the your appendix also. For this study, as is an acute appendicitis, we are not going um, to tell you to do a fasting or anything like that. We're just going to do the studies right away. If you are okay with that, are you? Do you have any questions or something that you want to tell us?
No, doctor, everything is okay.
So can we continue to do the CT scan and the abdominal ultrasound?
Yes.
Okay, thank you very much. Okay, Annie, here is your CT scan study that we did, and I'm going to explain it step by step. Here you can see the image on the left side is an coronal view, and on the right an axial view of the scan. And so starting from the coronal one, we can see that this right here is your appendix because it is joined to the colon. So that indicates us that that is your appendix. And moving in the axial image, we can see that your appendix is enlarged more than 6 millimeters. And there is also a periappendiceal fat stranding, an indication of inflammation. Um, and also there is an inflamed mesoappendix that we can see here in this image, and that is your mesoappendix, and it's also inflamed. And also here are the mesenteric lymph nodes that are enlarged in inflammation. Your lymph nodes tend to enlarge because they are trying to contain all the bacteria that is inflaming your appendix. Do you have any doubts or something that you want to clarify about your imaging study?
So, what will be the diagnostic,
Uh,
doctor?
yes, an inflamed appendix is called acute appendicitis, and for that, it is important to evaluate you to do a surgery called an appendicectomy.
Okay, thank you.
You're welcome. Hi, I'm Dr. Ernesto Tarango, and I'm going to be attending you today. Can you give me your name?
Yes, it's Annie.
Okay, Annie. Let's see what you have.
Well, doctor, I came here because I have been feeling pain in this part of my abdomen. Also, I have lost weight, but I'm eating less. I don't have much appetite. I have diarrhea, fever, and also my joints. I feel pain in my joints, in my right eye, and I have some skin lesions. I don't know why it does everything. I don't know why this is happening.
Okay, Annie. Because of your symptoms, I'm going to request a CT enterography, which is a specialized scan that gives us detailed images of your small intestine. It helps us assess conditions like Crohn's disease, inflammation, bleeding, or small bowel tumors. You will need to fast for 6 hours before this scan. No food or drinks except small sips of water for medications. About an hour before the scan, you will drink a special contrast liquid that helps us see your small bowel clearly. You'll also receive IV contrast and contrast from we're going to inject through the vein during the scan to enhance the images. Let us know if you have any kidney problems, contrast allergy, or if you're taking medications like metformin. Are you taking these medications?
No.
Okay. So during the test, you'll lie on the CT table. The scan takes around 10 to 15 minutes. You'll feel some fullness or bloating from the contrast, but it usually passes quickly. This test is safe. Side effects are rare and usually mild. If you are okay with everything, do you give your consent to proceed with the CT enterography?
Yes, I give my consent.
Okay, thank you very much. We'll proceed. Okay, and because of the symptoms that you explained to me, especially the extraintestinal manifestations of the disease, like you mentioned, you have arthritis and um, diarrhea with blood in it, and that is very indicating of a disease called Crohn's disease. So in the CT scan enterography that we order for you, here are the results of the image, and as you can see, we have this on the left side. We can see this asymmetric bowel wall thickening right here, and the hyper enhancement along the mesenteric side, which I signaled with the arrowheads in order for you to see it clearer and better. So yeah, we have this. The mesenteric side is where like the tissue grabs the intestine and fix it with other parts of your body. So that is sign of inflammation in your bowel, in your small bowel, and also there is a relative sparing of the antimesenteric side, which is highlighted by the solid straight arrows in the image, and those arrows are pointing to your ileum, which is also a characteristic part that it's affected in Crohn's disease. Also, findings well are consistent with inflammation that is secondary to the disease we are suspecting that you have, which is Crohn's. And the dashed arrow in the left image indicates the narrowing of the lumen of the small bowel loop, mm, which is when your intestine like gets a little like tighter because of the inflammation um, that it's damaging your small intestine, and that is also a sign of Crohn's compared to ulcerative colitis, which is also like another disease of the inflammatory bowel disease. Mm, so yeah, because Crohn's disease is a transmural type of inflammation. It affects all the length of your intestine. So yeah, and the curved arrow in the image, also in the left, shows the inflammation of the distal colon, which is also can be a characteristic of your disease, and that explains why you're having uh, stools with blood in it. Do you have any questions on me?
No, doctor, everything was really clear. Thank you.
Okay, no, you're welcome.
Hi, my name is Annie and I am going to be attending you today. What is your name?
Ernesto.
Okay, Ernesto. What brings you today here?
Yes, doctor, thank you. Like since yesterday at night, I have been feeling stabbing horrific pain here on this middle upper part of my abdomen, and it feels like someone is putting like a stag or like a date in my abdomen, and it radiates like to the back, and I can't even breathe because of the pain. It's very painful, and yes, I don't know what's happening to me.
Well, for the symptoms that you mentioned, we are going to perform a CT scan or a computer tomography scan, which is a special imaging testing that let us look to your blood vessels, bones, tissues, and organs in order to know what is causing your symptoms. For this, we need you to avoid eating or drinking for 4 or 6 hours, and also this is usually takes 5 to 15 minutes. This scan is quick and painless. You will hear some noises, it's only the machine working, and we also make sure that you're feeling comfortable all the time. Do you have any questions or concerns?
No, doctor, thank you.
Also, we will ask you to sign a consent in order to make the scan. Can you sign it?
Yes.
Okay, thank you. Hi again, Ernesto. We now have the results of your CT scan, and now I'm going to explain them to you. In your left, you see a red arrow that it's pointing at the common bile duct, and you can see that there is an calculi that impacted at the ampulla. Also, there are some orange arrows that show inflammatory stranding of fat around the pancreas, and also a little bit of peripancreatic fluid. And the yellow arrows show that while the majority of the pancreas encases normally, there are some areas that are abnormally low in attenuation, and this represents necrosis. So, with all these and the symptoms that you mentioned, what our diagnostic will be acute pancreatitis. Mm, do you have any questions?
Mm, and what's next for me?
We will have to do a surgery to keep the calculus, to remove the calculus, and also give you some treatment that I will explain you more profoundly in a moment. So, to control the symptoms that you mentioned, like pain and nausea and vomiting and all that.
Okay, I understand. Thank you, doctor.
Hi, my name is Annie, and I am going to be attending you today. What is your name?
Ernesto.
Okay, Ernesto. What brings you today here?
Yes, thank you, doctor. I have this very painful like sensation here in my abdomen, in this part, like center upper part of my abdomen, and for the last 6 months, I have been feeling this pain, and also my stools are like really fatty, and I have been having diarrhea, like fat fatty diarrhea. I don't know how to explain it, but in the um, restroom, it looks like little bubbles of fat in the superficial part of the water after I defecate, and also I have this like I'm feeling really thirsty all the time. Like my like I'm having a lot of uh, like I want to eat more. Also, I urinate a lot and drink a lot of more water. I don't know what's happening to me.
Okay, Ernesto. With the symptoms that you mentioned, we suspect chronic pancreatitis, so we are going to perform a CT scan or computed tomography scan, which is an imaging testing that help us to see your blood vessels, your tissues, and also your organs. This is quick and painless, and we are going to use an intravenous contrast. So we need you to stop drinking and eating 4 to 6 hours before the exam. Also, when we perform the exam, you're going to hear some noises. It's just the machine working. Uh, this usually takes 5 to 15 minutes, and don't worry, you're in good hands. We also need you to sign a consent. Can you sign it? Sign
Yes,
it.
of course, doctor.
Thank you. And after the exams, as you take some contrast, we're going to you need to keep hydrated in order to uh, expose the contrast faster. Do you have any questions?
No.
Okay. Hi Ernesto, we have now the results of the CT scan that we made to you, and here they are. Now I'm going to explain them to you. In the image of the left, you can see that there's an arrow. This is this one is pointing at the head and neck of the pancreas. And you can see that there are several calcifications that are like the white dots. Um, and also in the image of the right, you can see that there is a moderate to markedly irregular pancreatic duct that is um, pointed by the white arrow. And also there is an stricture in the pancreatic neck causing upstream ductal dilatation, and that is pointed by the black arrow. So the dilatation of the ductal and the calcifications and also the irregular pancreatic duct, these all with the symptoms that you mentioned points that this is a chronic pancreatitis. So we'll have to give you a treatment in order to uh, improve your symptoms. Do you have any questions?
Um, no, doctor, thank you. I understand.
Thank you. Hi, my name is Annie, and I am going to be attending you today. What is your name?
Ernesto.
Okay, Ernesto. What brings you today here?
Yes, thank you, doctor. I have been feeling this pain on this part of like my abdomen below my ribs, on the right side of my upper abdomen. Since yesterday, it was that after I had a hamburger for dinner, I I started feeling like this severe pain on my abdomen. I have been noticing that after fatty meals, like yesterday the hamburger, the pain worsens, and yeah, and some doctor come here before you and told me that I have a positive Murphy sign. He performed this maneuver in which I inhaled air and he pressed here and the pain was really bad. I I immediately stopped breathing. Yes.
Okay, Ernesto. With the symptoms that you mentioned, I am going to request an abdominal ultrasound to get a clearer view of your internal organs like the liver, gallbladder, pancreas, and kidneys. And this test uses sound waves, so it's completely safe, painless, and doesn't involve radiation. To prepare, you will need to fast for at least 6 to 8 hours beforehand. This means no food or drinks, except small sips of water if you need to take any medication or you are thirsty. Fasting helps us to get better images, especially of the gallbladder and pancreas. And during the test, a gel will be applied to your abdomen and a small device will be moved over the area to capture images. It usually takes about 20 to 30 minutes and you will be able to go home right after. Uh, there are no significant risks with this procedure. It helps us to make more accurate diagnosis and guide your treatment. Do you have any questions?
No, doctor.
Um, we are also going to ask you to sign and consent. Do you agree with all this?
Yes.
Okay, thank you. Hi again, Ernesto. We have now the results of your abdominal ultrasound, and I am going now to explain it to you. Here's an image of your um, gallbladder, and in your gallbladder, we found that there's a wall thickening that is pointed by the yellow arrow. There's also a gallstone, as you can see there. There is a big round white dot in the black space, and also there is pericholecystic fluid that you can see that is pointed by the blue arrow, and all of these with the symptoms that you mentioned point that it is an acute cholecystitis. Don't worry, it is treatable and you're in the good hands. Do you have any questions?
Mm, no, no, I don't have any questions. So that's why, uh, that's the reason of my pain, right?
Yes, primarily the gallstone, but that makes and that and the other things that you can see, the wall thickening and period cholecystic fluid.
Okay, thank you, doctor.